The Bismarck Cancer Center offers specialized types of therapy to serve cancer patients in the 701.
And Jennifer Matt is the REACH coordinator, and she joins us now. Jen, thanks for being here.
Thank you for having me. So happy to be here.
So what's your role at the Cancer Center?
So I'm the REACH coordinator at the Bismarck Cancer Center, meet with all our patients that do treatment, help with a program that's called REACH, and really that program was designed to lessen stress around your diagnosis and treatment. REACH stands for Resources, Educate, Advocacy, Care, and Hope. So resources, just want to make sure that someone's really well supported and they have everything that they need to complete treatment successfully. Educate, answer any questions that somebody might have. Advocacy, I'm a patient advocate, so want to make sure that treatment's going really well. If we need to do something different or better, you know, we want to do that. Care, I share a little bit about my story and my journey with cancer. And then Hope, my services for counseling are free and available during treatment, but also afterwards too. So my role is more to focus on making sure, checking in that someone's emotional health, their mental health, and their spiritual health is healthy too, because it is a big part of treatment and it's really important.
Absolutely. Now, getting a cancer diagnosis is stressful any time of the year, but I have to imagine over the holidays can maybe add just a little more stress. What do you yourself and the Bismarck Cancer Center do to help with not only patients but also family members deal with that diagnosis?
Absolutely. Holidays are really exciting and wonderful for lots of reasons and lots of people. But sometimes when a patient's going through treatment or hard times, it can be really overwhelming, it can be scary, it can be really long. So, I mean, if there's anything that we can do to help, you know, to make it a little bit easier, a little less stressful, we want to do that. So I think really my biggest advice would be, you know, just give yourself a little bit of grace. Maybe Christmas doesn't look the same as it did the year before or the year before, and that's okay. Give yourself some grace, don't beat yourself up about it. Surround yourself with your loved ones, let them lift you up and help you through this time. I think really asking for help is a good thing. Saying yes to help is a good thing. And the other thing, I think really just taking it moment by moment and just being really present, not thinking too far ahead or too far back or sideways or whatever it is. Just being really present with your family and your friends.
Well, I mean, that's a lot of head stuff. You know, so let's talk a little bit more about that emotional and spiritual help that you do provide, because it's a lot.
It is. It's a lot. And like I said, it's really scary, it's overwhelming, and knowing, you know, that you're not alone in this journey, that you have the Bismarck Cancer Center to help you get through that. We also offer a lot of different support groups, so I think that's a good way to connect with others that are going through a journey with cancer. We have more traditional support groups like the breast cancer, the all cancer and caregiver support group that meet monthly, but we also have some really non-traditional support groups too, like yoga we have, art therapy, we have equine therapy. So it's a good way, I feel like, to connect with others that are going through a journey with cancer.
Is there anything else that our viewers and us that we should know about the Bismarck Cancer Center? And specifically the support?
Sure. I feel like, so you have myself, the counseling services are free and available during treatment, but also afterwards. We also have support in the way of massage therapy. So patients get a massage a couple times a week. We have a dietitian that will help support you with food and nutrition. We have survivorship nurses, and oftentimes we'll help patients, you know, through Bismarck Cancer's Foundation raises lots and lots of money during the year, and those funds go directly towards the patient or to the patient. So we help with gas or lodging sometimes too, if that's something that they need. So anything we can do to make things less stressful for somebody, you know, we want to do that.
That's
Absolutely.
Really cool.
Well, Jen, thank you so much for being here. A lot of great information, and yeah, thank you.
Thank you for having me.
It's our pleasure. All right, for more information, folks, go to BismarckCancerCenter.com.